regard to the pediatric behavioral health therapy and essentially the autism provider rates, this is not something that we just brought up in the last couple of days. I know over the course of the summer, all the way back in June, we all started getting emails, or at least I started getting several emails with regard to the situation that was starting to occur where providers were leaving the state and was creating a wait list for the testing part for children who have autism, a wait list. And I think we all understand the importance of these children around the age of 3, the importance of them getting this test. And for them to have to go on a wait list means, 1, they're not getting tested, 2, it means they're not even able to get the services. But we also, it was brought to our attention about the loss of providers because of the lack of payment, the low dollar amount that the providers were receiving with regard to these codes that I gave to you yesterday in the motion. There are 5 codes that, I'm asking to have the current rates be increased with the new rates based on the MPRAC recommendation. I sent emails to the Healthcare Policy and Finance Department, and they responded. And I actually had a meeting in August with Director Bim Steffer, where she gave me several, and you can see all my notes on them, but several slides with regard to the autism spectrum disorder and the pediatric behavior rates. And at that meeting, she informed me that we were waiting, that the MPRAC was going to be looking at and making a recommendation on what the rates should be. And so I'm thinking, okay, so we're working on this project. We're working on this issue that's coming forward. In September, I actually kind of expected that we would have had more discussion or maybe a supplemental about it, but we didn't. And again, I think it was because we were waiting on the MPRAC to make their recommendations and make their decisions. It got to the point where we asked the department to come and present on this along with the MPRAC to tell us what was going on. And so the chart that is in front of you that I handed out, this colored chart, this is from information that was presented at those meetings with HCPF. And it clearly shows back in September the crisis situation that we are getting into for children with a disability, children who can't wait. And you can see here how the blue bar demonstrates the number of children receiving services, and then you can see the green and red lines that are showing the provider capacity, and you see what's happening from 22 to 23, 24, where the provider capacity continues to decrease and the children receiving these services or their needs continues to increase, and how we are waitlisting. You see that line, that red line that goes between there, and it's pretty clear there between the green dot and the blue dotted line of how we are waitlisting children to get their test so that they need to find out if they need these resources. And I know I don't need to remind anybody here that 1 in every 4 Coloradoans is on Medicaid. So again, I'm thinking the department maybe is going to come forward, especially after we saw what the MPRAC recommendation was with the supplemental. And when they didn't, I'm just going to say I was extremely disappointed that they didn't come forward recognizing that this is an issue that has been brought forward. It's been discussed certainly for the last year. For some folks, it's even been longer than the last year of bringing this forward. And especially I was a bit perplexed when they are reverting funds back, general fund money back, $22 million of general fund money is being reverted back. What a better use than to jumpstart these rates now so that we stop losing providers and that we get these kids off the wait list. I mean, how hard are we fighting to get people off the DD wait list? And what was even more perplexing to me is the response from the department wasn't to increase the provider rates so that we didn't keep putting children on a wait list to get their tests done. Their response was increase the pool of eligible children to receive funding. Now, I am not opposed to children who are at 250% of poverty, their families are at 250% of poverty in the CHIP program, to be able to get these services. But does it make sense to exacerbate the issue of providers leaving this state and increasing the pool of children eligible and not really addressing the need of increasing the rates. That just doesn't make sense to me. So that's why I brought this forward. We have the funds. It's not like I'm asking for a new $5 million out there, 5.2 million, shouldn't short it, but a new 5.2 million. I'm asking that the money that we are reverting back, that we use those funds, so instead of reverting back 22 million, we revert back essentially 17 million general fund monies, but that we don't make these kids wait to get their tests, that we don't go another day with more providers leaving this state and causing even a bigger issue in the future. You know, I could probably go into the importance of getting them tested at 3 years of age and getting them into the programs they need, but I'm thinking we all have an understanding of that, so I'm not going to go there. But these are kids with autism. They have a disability, and I don't understand why we're making them wait for testing or increasing that wait list when we have the funds that we already allocated to the Department of Healthcare Policy and Finance to provide for Medicaid provider rates. And this is, again, is not new money. So I'm asking for everyone to take that under consideration, and I hope that you will support my motion to increase the rates for these certain codes. Again, these are based on what the MPRAC brought forward in their recommendation, where I felt like they did a very thorough review and analysis and came back with what the rates should be. Thank you.
Okay, so I'm going to open this up now to comments on the dais, and I'm going to go with Madam Vice Chair and then Representative Sirota.
Thank you, Madam Chair. I would like to speak to this issue, and in particular, I would like to be able to address the timeline. Why is supplemental? Why not wait? And so I'm passing out a little bit of a timeline about the Colorado Autism Service Provider collaboration around the pediatric behavioral therapy. So just to begin with, back in 2019, the behavior therapy moved out of the waivers section and into what is known as EPSDT, which is the Early Periodic Screening, Diagnostic, and Treatment section. And at this time, the master's level rates were reduced at that time in 2019 by 34%. So HCPF at that time failed to adopt all the billing codes that are necessary to support these therapies. And in particular, they didn't adopt the codes for ending in 152, 156, and 157. If you look at the chart, those are among the codes that that Senator Kirmeyer is proposing to increase. So without adopting those billing codes, it limited the provider ability to address all family needs or lose money by meeting family needs but without the billing mechanism. Then in 2020 or 2019, spilling over into 2020, COVID hit. And during that time, we had a lot of providers that were shut down during that time, as with many other aspects of the healthcare community. But rates at that time were cut by 1%. So obviously, everybody was experiencing the cuts that we had to make because of the pandemic. And so that was not a time to bring up, wait a minute, we're already 34% down, but so they were in the same bucket as everybody else. So they just had to continue on. So the providers that were able to survive through COVID did so because they went out and they got PPP loans, or they took advantage of the ERC credits. They made adjustments to staffing levels, but unfortunately, this had a huge impact on some other areas. In particular, if you think about the cost of living that has gone up, and then business expenses have soared. So this is now 3 years into this process. Now that we have come out of COVID, companies are starting to get to regular business, and they're recognizing that we are not returning to normal. In fact, it is getting worse, progressively worse. So several companies start to go out of business. So much so, either through filing a bankruptcy or leaving the state to pursue more profitable markets, including the loss of local staff who've moved out of state or who are taking remote positions serving families in other states. So it kind of came to a head and started becoming pretty much a crisis situation back in 2022. So there was an emergency provider meeting that was put together between HCPF and the providers. In December of 2022 is when this emergency meeting happened between HCPF and the providers, where the providers were told by HCPF that they would investigate the situation and they would look into possible emergency supplemental rate adjustments. Well, obviously that didn't happen last year. And in fact, that never came to fruition, and they were put off again. There were also no increases in the budget, and what they were told is, well, hold on, and we will do an MPRAC review, and we will determine at that time whether we need to make any adjustments. So just hold on. And so then over the summer, as more companies started going out of business, we started hearing, I in particular started hearing from people as early as July, that I went back through my emails and started receiving pretty consistent emails, not only from providers, but also from families who lost their provider. They were kicked off, their provider shut down, and they were really experiencing trauma because, for example, the family that reached out to me in July lived in Greeley, and they couldn't find another provider that wasn't more than an hour away. And those providers have enormous wait lists now because there are fewer and fewer providers out there giving these services, which is increasing the wait list and the wait times for new clients, which is what all of these people who lost their provider are now, new clients. So right around that time, I reached out and I requested that during the supplemental hearing in September, where we were getting the forecast, that we have a conversation about it with the department. So we knew that it was coming, we knew that it was a problem, and we had a conversation with the department. Like Senator Kirmeyer, I kind of thought we were going to get a solution. We didn't. We were put off again and told, hold on, and let's get some information. Well, we got some information, and the MPRAC just verified what we already were telling everybody. And in fact, this proposal should, in my opinion, should have come forward last year after the emergency meeting in December. But we have good information now. It is verifiable. It has gone through the process of MPRAC. And in December, we lost 2 more providers. I truly believe that we're in a situation where we cannot wait until the next budget year to start improving on these codes just to go where we already know we need to be. Also, in addition to that, there's some other things that I think, speaking to the infrastructure, once a provider leaves, you don't necessarily get them back easily. It's not like they say, oh, well, the provider rate changed, so I'm going to go back into business. Once your infrastructure deteriorates, it takes a long time in order to build that back up. I just think that in order to stem the tide, I think that it's really important to act now. To this, why this and not something else? We have a lot of priorities, and I acknowledge that. There are a lot of heart-wrenching stories where everybody that is coming forward and asking for an increase has a really good case to make. Why I would say that I tend to prioritize this one is for a couple of reasons. It's a vulnerable population. It is a low-income population. It is a population that involves children, and the neuroplasticity of our children's brains need therapies early on in order to set them up for future success. And if you miss out on those opportunities, it has some serious consequences down the road. So if we can get to children sooner, if we can get the therapies in place sooner, if our families can start learning how to interact with their children and providing these things sooner rather than later, because childhood is short, I think that I tend to land on those types of priorities. Not to say that I don't think anything else is not a priority, I do. But in my mind, when I have to sit there and figure out how to weigh these things, that's what goes into my decision making. I will also point out that there is documented proof that there is 67% long-term savings to the state if we treat root behaviors, if we treat behaviors at the root cause. So this is patients will become more adept at social situations. They are better prepared to enter the workforce, and we help increase the overall efficiency of the Colorado economy by doing this. I think that a 12-month wait list is too long for a diagnosis because it just impacts outcomes significantly for families and children. I think that this is an area that has been documentedly overlooked for 5 years. So I would urge us to take action today.